for good
My
money.
belly button is this tag looking at me. I'm like, okay.
Now it's in the pictures.
So,
Okay, great.
The only guy here.
We're going to go ahead and get started. I start on time and I really try and end on time. So thank you so much for taking a half an hour out of your lives to learn a little bit more about health and about how the body works, and a little bit about how I work in my office. Hey, Roger, come on in. So the first question I'm going to ask, we're going to answer this question: what is functional medicine? The first question I'm going to ask is, before we talk about that, what is medicine? What is that? When we think of just general medicine in the United States, how would we describe that? And I'm just going to say this: I'm not against physicians. Roger's a good friend of mine. He's a PA. I'm not against medicine, but there is a difference. So let's describe regular medicine. How would we describe that when you think about it?
Medicates the symptoms.
Okay, so you're saying primarily symptomatic.
Mm-hmm.
Okay. Anybody else?
Involves a lot of pharmaceuticals.
Pardon me?
A lot of pharmaceuticals.
Pharmaceuticals. Okay. Terry?
I'd say it's the study of how the body works.
Okay. Okay.
Human body, to be exact.
Okay. Let me ask you this. If we were to look at the smallest part of the body where disease begins, the smallest part, what would that be?
Cells.
The cell. Exactly right. Disease begins at the level of the cell. All right. So would you say that the cell needs specific things in order to be healthy?
Yes.
Yeah. Okay. So if we have enough sick cells, what do we have then?
Disease, cancer.
Sickness.
Well, you could have cancer, yeah. Well, you have sick tissue. Okay, tissue is sick. If enough tissue is unhealthy, what do we have then?
Sick organ.
An organ that's unhealthy. Yeah, you get credit, right? And when you have enough organs that are healthy, or sick, what do you have?
Failure.
You have a real sick individual, right? Okay. So let's look at functional medicine. You look at the current health statistics in the United States. The U.S. spends more on health care than the next 10 countries combined. We have less than 5% of the world's population, yet we take 50% of the world's drugs and 80% of the world's painkillers. According to the World Health Organization, the U.S. used to rank 37th in health, but just dropped to 49th. And I think this is with primarily developed countries, because reading an article just recently, which I covered on my radio show, so I think it's pretty sure it's out of the Journal of the American Medical Association a couple of weeks ago. And what it said, if you look at all the countries in the world, I mean, we're talking about the really bad ones like Sierra Leone and really countries that have a Republic of the Congo. The United States ranks 32nd among all the countries in the world. Yet we have the most sophisticated healthcare system in the world. The third leading cause of death in the United States is the effects of properly prescribed pharmaceuticals and hospital errors. All right. So, and there's a study that came out a year ago. I think it was either a year ago or 2 years ago in the British Medical Journal about how many people in the United States die from hospital error. What was interesting is they put that study, they asked people on this medical website called Medscape, which is a website that I do access and like. And Medscape's pretty traditional medical website, but they have a lot of different articles on there. And they asked physicians what they thought about that study. Really interesting. You had half, well, I think they put on half and half, but half the physicians were pretty angry about it, and they're saying there's no way this could be true. And some of their responses I tended to agree with, like one of the physicians says, we don't have a problem with hospital error, we have a problem with health error in the way that people take care of themselves, and I thought that was pretty accurate. The other half of the physicians pretty much agreed with the study and said, I see it all the time. So I'm not going to say if the study was right or wrong, but no one's been able to refute it successfully yet that I can see. Now, this comes from the New England Journal of Medicine in 2012, okay? Our healthcare systems does some things really, really well, such as trauma care, okay?
Yeah.
Like Roger and I were talking the other day, taking things out of people's eyes when they get something in their eye. I mean, that's good stuff. But even the world's leading medical journals have stated the need for change. It says, although the United States pays more for medical care than any other country, we have problems in our healthcare system. This is right out of NEJM. Unsustainable costs, poor outcomes, frequent medical errors, poor patient satisfaction, worsening health disparities, all point to a need for transformative change. It says, unfortunately, many modifiable risk factors for chronic disease are not being addressed adequately. Then it says this, a prevention model focused on forestalling the development of disease before symptoms or life-threatening events occur is the best solution. How many of you believe that? Okay, it's a lot cheaper to prevent something than it is to treat it, a lot easier to prevent something than it is to fix it. Okay, well, the New England Journal of Medicine agrees with that, and they print it, and you could look this up. You could go to the NEJM website. This is a free download. 2012, look at the archive. You can read the whole article. There's more to the article than this, but that was a big part of it. So if you look at our current system, we do really well with trauma care. You have a heart attack, you have a serious accident, and our system works great, okay? However, those strategies don't help other things like fibromyalgia, diabetes, chronic fatigue, or arthritis. So we need another approach to those things. So what is functional medicine? Functional medicine looks at identifying what are the underlying causes of a disease so you can understand the origin of the disease and actually give the person meaningful treatment. Now, has anybody ever been to my class on fibromyalgia? Okay, a couple people. So in that class, we explore what are the underlying causes of fibromyalgia. Well, we do that in my class on cancer and thyroid problems and all kinds of menopause and all kinds of other things. We look at what are the issues here. So functional medicine wants to identify the cause of the disease rather than just treat symptoms. So if you look at the issue, first of all, disease starts at the level of the cell. And then there's functional medicine looks at two basic questions. Is the body not getting enough of something it needs? Or is there something in the body that shouldn't be there? It could be parasites, bacterial infection, toxic chemicals. Okay, let me just tell you a little story about this, toxic chemicals, that you guys, it's going to astound you if you haven't heard me say this yet. I found this in the New England Journal of Medicine. I'm pretty sure it was that journal about 3 weeks ago. There was an article about, they were doing an article on glyphosate, the Roundup. And there was this chemist in Arkansas who worked for the FDA. And so what he did, he decided to do a little experiment, a kind of offline, and he brought all of his food, samples from all of his food at home and tested it. And every single food item that he brought had unsafe levels of glyphosate in it, except for one, and that was broccoli. Broccoli was the only thing he tested that didn't have glyphosate. So do you think it's possible that we might be being exposed to toxic chemicals? Yeah, especially if you're eating processed food like crackers and chips, things like that. It's full of glyphosate, okay? There's glyphosate in that stuff. Toxic fatty acids. Where do we get that? What is a toxic fatty acid?
Is that trans fats?
Trans fat, right. Where do we get those?
French fries.
Yeah, French fries, yeah. Like
Processed vegetables.
virtually every processed food we eat, just about. And they're outlining this now in the United States. They're finally outlining. They can't. There's going to be FDA is outlining trans fat structural imbalance, which we treat here. Medication side effects, food intolerance such as gluten, dairy, and soy. Toxic emotions such as anger, greed, resentment, or unforgiveness. I just did a talk Saturday at Natural Grocers, and it was on emotions and health. And we had a man there that was trying to convince everybody that forgiveness is not necessary. And I'm thinking, I didn't argue with the guy. I didn't, but Robbie stepped in for me on that one. So did Dorothea. But you don't forgive, man. You're gonna poison yourself.
Yeah.
And it doesn't matter how healthy you eat. Doesn't matter how much you exercise.
Exactly.
If you don't forgive, you're gonna have problems. So then it says, is the body lacking in something that it needs? Okay, so it might need trace minerals. I see that all the time in hair analysis. Specific vitamins, phytonutrition, digestive enzymes, probiotics, exercise, positive relationships. So it either has too much of something it doesn't need, or it needs something that it doesn't have. And that's what we figure out in functional medicine. Because if you give the body what it needs, don't you think it can heal?
Yeah.
Okay. So the perfect example of that is, anybody ever laid on their arm and fell asleep? Okay, so what's the problem there?
Loss of circulation.
Yeah.
Or nerve interference. And so too much weight on the arm,
Yeah.
right? So you take the weight off the arm, the hand gets better, okay?
Yeah.
You don't have to take anything for that. You don't need surgery. You just need to take the weight off of that. Okay, so are the health issues we face in our civilization pharmaceutical deficiencies? For example, 1 in every 10 people in America take an antidepressant. Okay, could it really be that 10% of our population was born with a Prozac deficiency? There's just no way. Okay, and let's just talk about this in terms of functional medicine. Okay, so Prozac treats what? Depression. Okay, so chronic depression. Okay, so that's what Prozac treats, is depression. Treats a symptom of depression.
Right.
And I'm not saying that Prozac doesn't work for some people. Okay, it treats a symptom of depression. So how do we know that a person has a deficiency in the chemical that Prozac treats, which is it's on the
serotonin.
Serotonin, yeah. Thank you. Serotonin. How do we know that a person has a serotonin deficiency before we give them Prozac?
Symptoms?
No blood test for serotonin. I've never seen one person ever come in with a lab test that was taking serotonin. There's no test for it. Okay? 95% of the serotonin is made in your gut. Okay? 95%. Okay? This is where those gut feelings come from. So 95, there's no lab test for serotonin. So how do you know when somebody's had enough Prozac? You don't. Because there's no way to fit what?
Stomach ache goes away.
Yeah, maybe that's it. Yeah. There's no way of telling. Okay? So this is not a functional medicine approach to depression. So let's look at a functional medicine approach to chronic depression. First of all, what's causing the brain to malfunction? Is it a trapped emotion? Is it a food intolerance causing chronic inflammation in the gut that's spilling over into the brain, which we know that happens? Medical literature is very clear on that. Is it heavy metals or other toxicity in the brain? Things like mercury, things in vaccines even can cross the blood-brain barrier and accumulate in the brain. And in a couple of weeks, on July 3rd, I'm going to do a talk on vaccination. We're going to talk about the studies on that. It's going to be very interesting. Is it lack of sleep? Anybody ever got owly and mad or depressed because they didn't get enough sleep? And I have.
I'm not tired, I'm just crabby.
Yeah. I get pitchy, I get pitchy.
Yeah. Is it poor cardiac function? I've seen people when I do the heart sound recorder on them and I get their heart straightened out pretty good. I mean, their moods change. They have more energy. They feel more at peace. So we want to look at, and these are just some of it. It could be, relationship issues, but it's not a Prozac deficiency. So this is what I would look at if I were going to treat depression. Is I would look at some of this. So one of the most common drugs prescribed are the statin drugs. 30 million Americans take them, and here's side effects of statin drugs: muscle and joint pain, memory loss, no energy, loss of sexual libido, low testosterone, diabetes, and an increased overall death rate. So do we need, in other words, do 30 million people have a statin deficiency, a Crestor deficiency? Is that the problem here? We have too many people were born with a Crestor or a Mevacor deficiency. No, it's not the problem. Okay, so we're going to look at why somebody has high cholesterol. Let me ask you, what would you guys look at? Somebody comes in with elevated cholesterol.
Diet.
Okay, what part of their diet?
Fat intake?
Bad
Fat, like trans fat.
fats, yeah.
That would be one thing. But fat does not elevate cholesterol.
Genetics.
Okay, you could look.
Carbohydrates, blood sugar, insulin.
You look at sugar. That would be the thing that I would look at. How much sugar are you eating? Because your body takes sugar, excess sugar, turns it into cholesterol and triglycerides. Okay, but there's other things that can elevate cholesterol, like stress, and yes.
I was meaning more like the lack of eating healthy fats. Doesn't that affect it too?
Yeah. If you eat a lot of trans fats, that will elevate your cholesterol.
But what about healthy fats? Don't healthy fats combat that, or am I thinking of something else?
No, they like fish oil.
Yeah.
Yeah, when you eat fish, like cold water salmon, things like that combats that.
Okay.
Yes, absolutely. There's another thing that has a tendency to raise cholesterol. You're eating too much omega-6 fatty acid, like Wesson oil, which I would never buy that, by the way. Crisco, things like that. Sunflower oil, safflower oil. Those are not good. Those are not healthy fats. So let's look at heartburn. Okay, conventional doctors would prescribe pharmaceuticals like Prilosec, Prevacid, Acifex for reflux or heartburn. Functional medicine practitioner I would look for the cause. So first two things I would look for is, do they have low stomach acid, or do they have a pancreatic enzyme deficiency, which I can tell in the office very quickly. I can figure that out pretty fast. They have food intolerances. I mean, do they get sick every time they eat certain foods? An H. pylori infection, leaky gut, gallbladder dysfunction, hiatal hernia. Are they drinking too much soda?
When you say soda, what is it about the soda? Is it sugar or is it what?
Well, it depends on the soda. Like Coca-Cola is just very acidic. I mean, you can clean batteries out with Coca-Cola.
So the soda, when you say too much soda, it's the acid.
Too much sugar.
Yeah, and the sugar, but they're
Acid.
very acidic.
So it's not the carbonation.
Well, with Coca-Cola, it's phosphoric acid.
Okay.
Yeah, and that can really cause distress with a lot of people.
It's a bad acid.
Yeah, it's a bad acid.
Too
Too
much
much of
stomach
it is.
acid, but phosphoric acid isn't.
Your stomach acid is hydrochloric
Yeah,
acid.
so they're different kind of acid.
Yeah, different kind. Yes.
So like those flavored waters, I drink them sometimes, and they don't have anything added to them. It's just like carbonation.
Yeah, I drink them too.
Is that something that?
Yeah, they're okay.
Because sometimes I eat something and I think it's healthy, and later on I'm like, crap.
Yeah, that was my point. Finding out if carbonation was the.
No, I drink
the
those
one.
flavored waters myself occasionally. We get them, just for a change.
Yeah, because I love water, but I get
Yeah.
burnt out every once in a
Yeah,
while.
sometimes you just want to
Lots of
change. Okay,
bubbles.
nothing wrong with that.
Yeah, okay.
Yeah.
I'll tell you about the bubbles later.
Okay.
So if we look at the issues with functional medicine, it's like an iceberg. The symptoms are like the top of the iceberg, but the underlying causes are the other 90% of the iceberg, which sits below the water. So it could be hormone imbalances, toxicity, structural imbalances, mitochondrial dysfunction, which is part of the cell, toxic chemical exposure. All of this is causing these symptoms. Your body just doesn't invent things to make you miserable, okay? It doesn't do that.
Contrary to what you think sometimes.
Yeah. I mean, as much as we want to think it does, it doesn't do that, okay? There's a reason why everything happens in your body. Now, Sir William Osler, this is a guy that started Johns Hopkins Medical School. I have a lot of respect for him. He was really kind of a functional medicine guy, and he's very well respected, very famous guy. He said, here's what he said. He said, the good physician treats a disease. The great physician treats the patient who has a disease. It's more important to know what sort of patient has a disease than what sort of disease has a patient. Okay? And he was the originator of the medical residency program. Another saying by Osler says, if you listen carefully to the patient, they will tell you the diagnosis. Wouldn't you say that's true?
In
Yeah.
med school.
What?
My daughter said that in med school. She says 80% of the patients, if you do a good interview, 80% of the time you'll be able to figure out, the patient will tell you what they have.
Yeah, that's right. That's really important to listen to the symptoms and what they tell you. So this quotation encapsulates the importance placed on taking a thorough history from the patient. So let's look at some case studies that I've seen in my office with functional medicine. This is a 3-year-old boy that came in to see me. He had chronic runny nose, congestion, allergies, and asthma. Okay, so he was taking nasal spray, asthma meds, and albuterol inhaler. 3 years old. What I found in him, structural imbalances in the neck causing neurological compromise. He had allergies to milk, sugar, rice, egg, cat, and dog hair. So we figured that out. We took that away from him. And he was developing intestinal permeability. So when we did all of that, we adjusted him, we took all the stuff away. Congestion and runny nose is gone. He's off all of his drugs, and I see him on an as-needed basis.
Does he get back to eating what he was allergic to eventually? And with treatment, can you get him, after he's got detoxed and straightened out, can you get
Possibly, but not necessarily, not always. I don't, for example, I was telling one of my patients, I was telling you guys today, when you're in my office, if I had a big piece of tiramisu, a really big piece, I'd get a canker sore within 5 minutes. It'd be that fast. Sue, I don't think that my body will ever adapt to tiramisu. It just won't. So I stay away from it. But and other things like that, okay? So here's a 48-year-old female. She had chronic fatigue, mental fog, anxiety, depression, irritability, metal taste in her mouth, and hypothyroidism. So we found a lot of food intolerances, mineral deficiencies, hormonal dysfunction, low stomach acid, dehydration, vitamin D deficiency. So we just we started her in the Kangen water, corrected her nutritional deficiencies. She stopped eating the foods that she was intolerant to, and we used formulas to help her hormonal dysfunction, and the symptoms either went away or really diminished. And sometimes with people, you can't fix everybody. I wish I could tell you that. Sometimes like a 60% reduction might be as good as you can do with some people. Some people you can fix, a lot of people you can, but not everybody. Sometimes there's so much damage to the tissue that you can't get 100% correction. You try, I try, and then sometimes, sometimes as a patient, they won't stay with you long enough or whatever. But here's a 13-year-old female. This is one of my favorite ones. She contracted mono 12 months ago, and then she had the flu over Christmas. She developed the following symptoms. She had to drop out of the 7th grade. She had daily migraine headaches, persistent vomiting, chronic fatigue, daily abdominal pain. So what I did is I adjusted her. Now I don't remember if we did much lab testing on her. Her mother had been through a divorce, didn't have a lot of money, so she brought in foods and we tested her like that. We gave her supplements. We took her off foods that she was intolerant to. We adjusted her. There's some organs that I had to fix through visceral manipulation. And then, her migraine headaches got better. They didn't go away, but they got better, okay? Stomach pain and vomiting left. She got her energy back. She's able to go back to school, and she's able to go back on an overseas missions trip. So that's all good, okay? And, I think that with this particular patient, I think that the reason I couldn't get rid of her migraines is because I couldn't do any testing on her, really, other than what I did in the office. I couldn't do any blood work on her, things that I really needed or would have liked to have done. I think that's why we couldn't get that fixed in the end. So that's my experience with. I could put up a lot more patients there with functional medicine, but that's pretty much my experience. Does anybody have any questions about functional medicine and what it is? Yes.
It's not really a question. It's more, I don't know if I ever told you, when you diagnosed Hunter, my middle son, with the gluten intolerance, I went gluten-free with him at the time because I didn't want him to have to be the only one at functions who wasn't eating like cupcakes or, the fun stuff. And I did it because I loved him, but it was crazy. On the 3rd day I woke up and it's like somebody had flipped the switch, and my seasonal allergies that had sucked the life out of me for like 7 or 8 years, every spring and every fall, were gone. And kind of like to go along with that comment that she made, could you ever go back to it? People ask me that all the time. Well, when are you going to go back? And I'm like, never. I have no desire to eat bread. If it means not having Kleenexes shoved out my sinuses for 3 months straight every time the seasons change, I'm good.
Yeah.
So, that's a huge difference. And at the time, it's hard, but sometimes you have to say no to smaller stuff to say yes to something bigger.
Yeah, that's right. Exactly right. Yeah, good. That's a very, very good comment. And there's foods I can't eat either.
Yeah.
I don't drink milk, for example. I just can't tolerate it. I just don't. So, everybody's got food intolerances. I've got them. Sugar, milk, sugar and dairy are my 2 big ones. But yeah, I totally agree with you. And it's not worth it.
No. You smell the bread and then you just keep walking.
That's right. Keep on trucking, right? Yeah. Okay, Terry?
Why do people develop, after a lifetime of not being allergic to something, like food? Let's just pick on food, since we're kind of on that topic. And you go, why do some people develop an allergy after 60 years of not being allergic to something? Let's just say watermelon or tomatoes or something, and all of a sudden they're now allergic to that.
That's a great question.
And they can't eat that.
Here's the reason. There's 2 reasons. Number 1 is that your body, when you eat something over and over and over and over again, your body has a tendency to get sensitized to it over time. I'm not sure why that is, but it just does. Here's the second thing, though, and this is something that we're proving, is that so many of the produce and the products that we eat they're hybridized, and they have pesticide residues on them. And when you eat something over and over, there's a pesticide residue. Sometimes your body's actually reacting to the pesticides along with the food. And so that's another issue, is the things that come along with it that we generally shouldn't have. There's one other thing, and that's hybridization. The foods that we eat now are radically different from the foods that our ancestors were eating right around the turn of the century. So they're not hybridized like they were. They didn't have seedless watermelons back in 1900. That's been something that's been genetically engineered over time. And so our bodies can't keep up with the changes in the types of protein that we're actually inventing. Our bodies can't keep up with that, and they develop sensitivities to it.
Are GMOs causing some of this
Yes.
allergy stuff too?
Yes,
That's
they
what I
are.
think it is.
They are. They are causing some of it. Yes.
Let's think about the way they treat wheat. Isn't all wheat defoliated with glyphosate? Before they harvest it, they douse it with Roundup.
They degerm it and all this stuff. Yeah,
And
they
oats
take
are
it.
full of it. They're full of glyphosate. You know, non-organic oats. So a lot of it is due to that. And so, you know, in our house, and we don't do this perfectly, we try to use organic and free range as much as possible. We don't do it all the time. And of course, when you go out to eat, you know, all bets are off.
I don't know what you're getting, yeah.
There's one more thing.
Yeah.
As you age, your immune system changes too.
It gets tired.
I
So
believe that.
things that you know didn't bother you 30 years ago can bother you
Now that
today.
you're 60,
Yeah.
for some
And-
reason, yeah.
And
You're
I
allergic.
agree with Paul because I see patients all the time, and they, especially now with allergy season,
Oh, golly, yeah.
it's like, well, I was never allergic to this 2 years ago. Well,
Yeah.
immune system changes, and exactly what you said. I mean, there's so much chemicals and crap in the air, fertilizers and all the pesticides and stuff, which weakens our immune system too. So,
Yeah, that's a great point about our immune system getting weaker as we get older. Why do you think that is? I mean, is it just the natural process of aging, and do you feel like there's ways that we can preserve our immunity to last longer? I mean, I think there are, but what do you think?
it's the same thing, you know, exercise is a great thing to stimulate the immune system. But what happens as we age? We get fatter, we exercise less, and so it's the spiral thing. It's like depression. You know, you get depressed, and then things just start going down and down and down, and some people never get out. And the same way with the immune system. You have to force yourself sometimes to exercise and to stay away from glutens. If you know you're allergic to them, you don't want to fill your body full of them, and that weakens it. Is if you know, so many people are weak, and I'm one of them. And you know, if you know something's not good for you, but still you still eat it, or you hang around in an environment that's not very good, it stimulates and breaks down the immune system. So.
Yeah, I agree. I think exercise is key to promoting healthy immune system. Eating whole foods, real food, you know, where your body can actually extract real nutrients that it needs. You're taking food supplements that have real stuff in them rather than synthetic nutrients, which a lot of things do. I think those are all things that are really important. Laughing, you know, that helps the immune system. That's been proven to help.
Yeah, it's therapeutic.
Yeah, so doing things like that, it's all good. So getting out in the sun, sunlight increases vitamin D levels. Vitamin D is directly correlated with the immune system. So those are all ways you can do it. Another thing that helps the immune system is what we call earthing, walking around barefoot. You know, there's something about the ionization in the earth that your body pulls up, and that's been shown to be factual. And so the way that, and it's hard in our culture. So the way that I do it personally is I mow my lawn barefooted. That's the way I earth. Because otherwise I never get out barefooted enough. So I mow my lawn barefooted. And it takes me about 40 minutes to do that. So for that 40 minutes a week in the summertime, I'm out barefooted and I'm getting some of that ionization. So otherwise, you know, I don't get to the beach enough.
I take it you have organic grass.
Yeah, that's right. That's a good point. We don't chemicalize our grass. We have the best crop of dandelions you'd ever see. It's world class, believe me. You're right. I don't chemicalize my lawn. That's true.
But you harvest the dandelions to make the dandelion oil to help with the cancer.
Well, we should. You know, we should eat the dandelion. Yeah, the dandelion leaves. That's right.
Is dandelion oil a cancer treatment?
Well, there's some new research out on that supposedly
Cash crop.
it helps certain cancers.
Where do
yeah.
you live?
They're everywhere.
Yeah, I've got plenty to do. If you want to come down, feel free.
Pick all you want, right?
Yeah.
But yeah, all of
Money
these
to get mine.
perfect lawns that are just perfect, no weeds. I mean, you know, grass doesn't get like that on its own. And mine sure never has, I can tell you that. And so, you know, you make choices like that. I've chosen not to chemicalize my grass for that very reason. And so it doesn't look as good as the rest of the neighborhood. So, you know, I live with it, it's okay.
As long as you're not the Department of Association, you're okay. So.
Yeah, I mean, nobody's complained so far, so.
You're not striving for yard of the